Alright, good evening class. Today our lesson is understanding the role of dyslipidemia in the etiology of myocardial infraction. When we are talking about dyslipidemia simply means an abnormality of what? Fat, preferably bad cholesterol in the human blood. So dyslipidemia, we can explain dyslipidemia by using this schematic diagram. Dyslipidemia will lead to the what? High elevated levels of LDL. LDL simply means low density lipoprotein. And we have also high levels of very low density lipoprotein. These proteins or these lipids are referred to as bad cholesterol. And when they are found very high in the human blood, they can lead to what we call dyslipidemia. Dyslipidemia, again, irreversibly, will lead to decreased level of high density lipoprotein. High density lipoprotein are referred to as good cholesterol in the system, and the human system needs it for proper function. So when you have high elevated levels of LDL and vain LDL, it can lead to what we call dyslipidemia. There are other terms too that we need to understand, just as myocardial infraction. So when we talk of myocardia, what is myo? There are two word parts, myo. The first one refers to what we call muscle, and the second one, cardio. Cardio refers to what? Heart. So the two word parts putting together, we have what? Heart muscle. That is simply meaning myocardia. And infraction, when we say infraction simply means what? Any disturbance or damage to tissues. So in other terms, we can say what? Damage to heart muscle. That is simply what we meant by myocardial infraction. So we will look at how dyslipidemia plays a role in what we call myocardial infraction. Myocardial infraction, we can also, other words, we can say heart attack. Heart attack simply means myocardial infraction. So dyslipidemia, when there are high elevated levels of this bad cholesterol in the system, what usually happens that we experience heart attack? So there are 5 implicated roles that usually take place in order for one to experience what we call myocardial infraction. And the first of all is what we call arteriosclerosis. Arteriosclerosis, what is arterial? The word arterial meaning arteries, sclerosis meaning hardening. So when you put them together, we have what? Hardening of arteries. That is what we meant arteriosclerosis. So dyslipidemia, what this bad cholesterol or fat does is that they will infiltrate on the vessels or on the inner lining of the arteries, just as we are seeing on this schematic drawing. And mind you, these drawings are not drawn to scale. So this is what refers to what? The LDL, bad cholesterol or very low density lipoprotein. This part will infiltrate on the inner lining of the arteries, thereby leading to excess accumulation of what? This bad cholesterol. With time, as time progresses, this formation of artery or arteriosclerosis continue to expand. It will continue to grow, thereby narrowing the blood vessel. And in other words, we know the main artery that carries blood to the heart is what we refer to as the coronary artery. So when it happens on that coronary artery, it narrows the formation in which blood flows to the heart. By this narrowing, it irritates the what? The vessel of the heart, leading to what we call chest pain. And in medical term, we call it angina. Angina simply means heart pain. And mind you, angina is different from what we call myocardial infarction, because angina cannot lead to cell death, but in myocardial infarction, the end result will lead to what? Cell death. So this narrowing of blood through to the heart can lead to what we call plate instability. So this deposit or accumulation of fat leads to the formation of plaque. So excess accumulation of the fat will lead to the formation of plaque. So as time goes or as it progresses, there is pressure that will mount on this plate, making it variable and becomes unstable. Therefore, it will, with time, it will burst. And when it bursts, it will be exposed towards the blood in circulation. And when it is exposed to blood in circulation, there will be recruitment of what? Microphages and phagocytic cells, and we also have recruitment of clotting factors coming into play role. And the main purpose of clotting factors coming to play role is to put the damaged tissue to repair. So in order for the damaged tissue to be repaired, as there is more of the clotting factors coming there, it will lead to what we call the formation of thrombi. Which simply means blood clot. That is what we mean by thrombi. This thrombi, it depends on the extent of which it is formed. In other cases, it can form smaller, others bigger. So when it happens that this thrombi is formed and it becomes big, it leads to what we call what? Blockage or obstruction of the cell or the inner artery wall. It will block the whole of the artery. It will block the whole of this artery, depriving this side it will deprive the other aspect of the artery from what? Oxygen and nutrients. And we all know that blood carries what? Oxygen and nutrients to all parts of body tissue, because the blood contains hemoglobin, which is the molecule that carries oxygen and other components of what? Nutrients to supply. When this obstruction deprives this side of the muscle from the oxygen and the nutrients, this is what that leads to myocardial infarction. This obstruction will lead to myocardial infarction. And in this case, we will experience what we call ischemia. Ischemia, and ischemia in medical term, inadequate supply of blood to tissues. There will be what? Inadequate supply of blood to tissue. And if there is inadequate of blood supply to tissue, the body will sense hypoxia, which will lead to what? Tissue death. Oxygen and nutrients. There will be what? Tissue death. There will be tissue death due to deprivation of oxygen and nutrients. And this cell death is what refers to what? Necrosis.